Cancer and its relation to microbiology. So here I have a list of several viruses and the cancers that they cause. First, I have Kaposi sarcoma associated herpes virus, or human herpes virus 8. It causes Kaposi sarcoma. Epstein-Barr virus is linked to gastric cancer. Human papillomavirus is linked to oropharynx cancer. Hepatitis C virus causes hepatocellular carcinoma. And Merkel cell polyomavirus is linked to Merkel cell carcinoma. Kaposi sarcoma, again, is caused by Kaposi sarcoma associated herpes virus, also known as human herpes virus 8. It is considered a multicentric neoplasm of lymphatic endothelium. It is characterized by frequent cutaneous lesions. You'll see it many times. It looks like large blood spots. If you've seen on elderly people, perhaps your grandparents, they have those large blood spots on their hands. It looks much like that. There are two courses of Kaposi sarcoma. The classic course of sarcoma is generally found in men from Mediterranean countries, and it's a more indolent course. It's slower spreading, fewer symptoms, harder to identify. Endemic KS is found in sub-Saharan Africa, and it can be indolent but can also be rather aggressive, has more aggressive cutaneous lesions, easier to spot. Kaposi sarcoma associated herpes virus is an oncogenic double-stranded DNA virus. It's transmitted via saliva and sexual intercourse. It is biphasic with a distinct lytic and latent replication cycle. It infects the spindle cells of KS lesions, which are endothelial cells that express various specific lymphatic lineage proteins. It infects many times T lymphocytes, beta cells, and monocytes. Epstein-Barr virus associated gastric cancer is, as its namesake, caused by Epstein-Barr virus. It's a malignant gastric adenocarcinoma with lymphoid stroma. It starts in glandular tissue that makes mucus or fluid, and these lymphoid stroma release chemical messengers that facilitate interactions between hematopoietic cells and also facilitate hematopoietic cell migration. There are approximately 75,000 new diagnoses annually. The causative agent, Epstein-Barr virus, is also known as human herpes virus 4. It infects over 90% of the adult population due to its asymptomatic state in many cases. The precise epithelial infection mechanism is not very clear. Cell-to-cell contact mediated by the B lymphocytes is the predominant manner of entry into cells. The virus targets oral mucosal epithelium and oropharyngeal beta cells in early infection, and the viral genome replicates along with the genome of the host cell in its latent state. Here I have a diagram of the mechanism of entry and infection for the Epstein-Barr virus. Here in the center you can see a diagram of the mutation in the host genome, signifying the reproduction of the viral genome along with the host genome. The virus is resistant to apoptosis or programmed cell death, and here you can see the production of viral proteins and viral miRNA, which promote viral proliferation. Oropharynx cancer is generally caused by human papillomavirus. Oropharynx cancer is characterized by lesions at the base of the tongue, the palatine tonsil, the soft palate, uvula, wild eye ring, many of the oropharyngeal structures of the body. There's approximately 100,000 new cases that occur annually in the world. It primarily arises from the specialized reticulated crypt epithelium in the lingual and palatine tonsils of the oropharyngeal tract. Little is known regarding the induced carcinogenic infection process, but it is known that human papillomavirus is primarily sexually transmitted, and there is a very effective prophylactic vaccination for HPV. Hepatocellular carcinoma, or liver cancer, is caused by hepatitis C virus. It's a heterogeneous tumor with frequent intrahepatic spread and extrahepatic metastasis, meaning it spreads throughout the body. Epigenetic changes contribute to its onset, and it is the third most frequent cause of cancer death in the world, with over 600,000 deaths annually. It's the fifth most common cancer in men, the seventh most common in women. Its causative agent, hepatitis C virus, is an envelope virus with a positive sense RNA genome. The virus has an exclusively cytoplasmic life cycle, and it does not integrate into the host genome, but causes chromosomal instability, which causes issues with the regulation of chromosomal processes and mitotic spindle formation. Lastly, Merkel cell carcinoma, or neuroendocrine carcinoma, is caused by Merkel cell polyomavirus. It's a rare type of skin cancer, usually appears as a flesh-colored or bluish-red nodule, often on the face, head, neck. They're common in elderly individuals, and there's an increased risk from long-term sun exposure or weakened immune system. So it's good to wear your sunscreen to decrease the risk to some extent. The causative agent, Merkel cell polyomavirus, was first detected in Merkel cell carcinoma in 2008, so it's somewhat recent. Its genome encodes a large T antigen, which is a potent oncoprotein capable of transforming various types of mammalian cells. In some cases, it becomes integrated into the genome of the tumor cell, so it would be being reproduced. The genome would be reproduced along with the host cell genome.